Hello everyone, my name is Yunqi Zhao. Now I will give you a presentation about workplace stress in nursing and patient safety. As nursing is a unique occupation associated with many unpredictable situations, work-related stress is ubiquitous for nurses all the time. There are many different stressors that make nurses feel stressful with their job, such as high workload, shift work, role conflicts, experience of aggression, and so on. In my presentation, I will discuss how workplace stress is related to patient safety and a healthy workplace, which mainly focuses on the stress caused by working overload. Before I will continue on my topic, I would like to introduce the definition of workload first. Workload refers to the ratio of demand or task load for available resources, such as the number of nursing staff working in one shift. Other factors can also influence nurses' workload. For example, how many patients are there in the ward? Or will nurses need to provide complex healthcare within limited time? These factors can cause more difficulties in nurses' work and increase their burden. However, why it becomes such an important problem? Because working overload can cause the potential risks for both nurses and patients. From the perspective of nurses, stress can affect their health and well-being. It can lead to physical response such as tiredness, loss of appetite, nausea, and so on. People who work under stress for a long term are more likely to develop many stress-related problems and even chronic illness, which will increase the risk of heart attack. Apart from that, stress can also activate people's psychological response, like frequent worry, anxiety, poor concentration, and impatience. It will increase the possibility of developing mental illness. Furthermore, nurses who are working overload will be less able to make sure patient safety. Stress can significantly affect patient safety and reduces the quality of health care that patients received, which would be more difficult to achieve the expected outcomes. Many researches also show that high workload can not only cause staff physical tiredness, but also increase the occurrence of medical errors, which is unpredicted but avoidable. In order to solve the problem and help nurses to cope with the workplace stress, the governments and faculties have published a series of policies. For example, the Stress Management for Nurses from New South Wales Nurses Association is designed to bring the awareness of nurses' mental health needs and assist nurses to manage the stress from workplace. In addition, nurses should also be supported to find out their own coping strategies towards workplace stress, as it can also benefit in improving resilience, which will be discussed later. Nurses will be able to manage their emotions better and protect patients from potential harm. Apart from that, as nurses can be stressful due to excessive workload, it is essential to make adjustments in the work allocation, which is also a necessary intervention to reduce the stress at the beginning. Then, effective leadership can make great contribution to reduce the stress caused by working overload. As a supportive leader and experienced nurse, the nursing unit manager should be more aware of the high workload and make a reasonable allocation of patient load. Moreover, the nurse should also be responsible for a healthy and warm workplace. For example, every staff is supposed to be cared and accessible to the support when facing with great stress. Then, move on to the next slide. We all know that effective leadership can play an important role in coping with work-related stress. But what is exactly the clinical leadership? It is clearly defined that clinical leadership should be able to support all the healthcare providers, considering their physical and mental health needs, and deliver high-quality patient care at the same time. And these characteristics should be found in a good clinical leadership: clinical competence, effective communication, role model, and so on. It will benefit in reducing the influence of workplace stress by supporting other staff who need help, presenting possible solutions, and effectively motivating the colleagues. Furthermore, Resilience in nursing is also essential in coping with work-related stress, which is also associated with effective clinical leadership. In the Turner 2014, nursing resilience can be defined as the successful adaptation of reality and the ability to cope with stress and adversity. And the characteristics such as rebounding and seeking for support are also involved in the resilience. With the improvement in nursing resilience, nurses will have a stronger ability to adjust themselves towards challenges and other difficult situations. However, as a new graduate nurse, what should I do to perform my responsibility? According to the NIBA 2018, I should reduce the effect of fatigue and tiredness, not only for myself but also for my colleagues. That is to say, I should examine myself or other nurses' condition to see whether it is able to work. In addition, I am supposed to seek for help or offer support when appropriate. It aims to make sure the safety for nursing staff and then be responsible for patient safety. Besides, building up a good relationship with colleagues will be easier for new graduate nurses to find out what's going wrong, such as too much work to do. It will benefit in the development of a healthy working environment with less stress. What's more, to cope with the stress caused by working overload, practice within my scope of practice can make me safe and minimize the influence of the stress in the ward. In the Registered Nurses Standards for Practice, it is pointed out in Standard 6.3 that nurses should appropriately delegate practice with other staff, also considering their scope of practice. In other words, a successful division of tasks will not put my colleagues overload, which can also be regarded as the condition of patient safety. Next, nurses should also maintain their professional boundaries in the clinical environment. Professional boundaries are aiming to protect the space between nurses' power and the patient's vulnerability and mark the edge between professional and non-professional relationships. That is to say, nurses should be able to manage their emotions related to workplace stress and try not to affect their patients and colleagues. In order to successfully maintain professional boundaries, it is important for all health professionals to reflect themselves on needs, behaviors, values, attitudes, and beliefs. It will help them to realize the stressors and not let the negative emotions pass on other people. What's more, nurses should also follow the code of ethics. In the value statement 4, nurses should value the health of colleagues to see whether they are able to provide health care for the clients. For example, can they physically afford the workload, or are they suffering from great stress and not able to provide medical service? As a nurse, we should care and be responsible for both the patients and our colleagues at the same time. To summarize, I have mainly discussed the workplace stress caused by working overload and how it can affect the nursing staff and patient safety in today's presentation. Then, some possible solutions associated with leadership were also given. And I have also explained how clinical leadership can help and what responsibility a new graduate nurse should perform. In order to support my opinions, I used the guidelines and policies from the government, together with peer-reviewed literature. I hope nurses could show more care and respect to their colleagues through effective communication, which will help them to reduce the workplace stress. At the end, the last 2 slides are my reference list. Thank you for listening.